Wow, what an inspiring discussion. Thank you, Ms. Samia Anwar Rafa, for moderating this session, and also thanks to our panelists for joining us today. And now we will move to our next segment. For that, I would like to request our next moderator. Our next moderator, Maya Igarashi, Sanitation Lead, WaterAid. I'm requesting you, please come on stage. And also, I would like to invite our two honorable guests, key role speaker, Keshav Das, Program Specialist, UNICEF South Asia Regional Office, and key role speaker, Dr. Tanvir Ahmed, Professor, Bangladesh University of Engineering and Technology. Please take your seats. Thank you.
Good morning, everyone. I hope you had a good rest and also very much energized this morning with the very committed, engaged youth voices and also their actions to advance this sector. So I would like to start first introducing myself. I'm Maya Igarashi from WaterAid UK. I am going to moderate this session on gender, equity, disability, social inclusion, but also climate resilient sanitation with two experts between myself. And then in order to start quickly, I'd like to do a little bit of a recap of yesterday's, the day one of this conference. I had in the plenary and some sessions that I went and also myself facilitated, there was quite often the notion of gender inequality in sanitation in this country, in the region, but also globally. Lack of access to gender inclusion, inclusive toilets, but also impact of poor or absence of such inclusive toilets at households, in communities, but also in public places. I also attended one session around the inclusive toilets and how to make that more systematically part of all interventions done in country and the municipalities. But in reality, still there are many toilets in public places not always designed for, if not with, persons with disabilities. And some of them, if not many, are often dependent on caregivers, hence that reduces also their dignity and their privacy. And one area that I haven't had yet much, perhaps you have sessions, technical sessions more discussing about, around the issues, persistent stigmas and the social barriers for certain religious and also ethnic minorities and the marginalized groups to either access sanitation or working to provide vital sanitation services, but in poor and insecure working conditions. So the challenges are huge, and there have been a lot of already discussions and the solutions, good practices being shared. But on top of that, the climate change is not making our life easy. And it is really unimaginable rather, the impact that it makes to those people with less coping mechanism and capacity. Then just to wrap up the setting the scene introduction, in the morning session, Juliet mentioned some of the positive notes related to climate resilient sanitation. In order to have a lasting and a sustainable sanitation services, we need to take the model to change the rules, change the norms and the standards, and then we need to consider more those marginalized groups, women, as part of solution, contributor, actors to advance the sector. So, with that note, I would like to ask first speaker how does that look in more practice, but also unpack that climate resilient sanitation part to continue from the yesterday's discussion. And then I'd like to invite Mr. Keshav. Yes, please go to the podium over there for the presentation. He had specialized in climate change, energy, and multilateral engagement, energy sustainability, and public policies. He has spearheaded climate action initiative for UN and other various international agencies and the development banks. Currently, he works as regional program coordinator. Sorry, that's your previous title, isn't it? you work at the moment at the UNICEF regional office in South Asia as program specialist for climate and the environment. So over to you.
Very much, Maya, if you can hear me all. And it's an honor to be part of this very engaging conversation for the last 1.5 days now. And as my moderator has rightly pointed out, yesterday we talked in different dimensions about climate resilient sanitation and also water, if I may put it in that way, considering that water is the core problem of, or the core cause of the climate change. More water, less water, no water. I think that's becoming a bigger problem than how we are going to address that from the climate resilient sanitation in a country which is extremely vulnerable to climate change, and that is Bangladesh. So I think that's the topic of the discussion today. I just want to highlight here that while it is a problem of toilet, as yesterday in the plenary it was very rightly pointed out, some of our esteemed panel member, that what is clean toilet, and to amplify that climate resilient clean toilet, I do believe that the problem is not necessarily limited only in Bangladesh, but that's in the region as well as a global problem. I'm putting here some of the data just to initiate the conversation today. And if you can see that around 4 billion people, which is half of the population of this world, are not having basic clean sanitation. Many of these figures are known to you, but however, a quick recap on that. And if you look into the South Asia in particular, that's also a significantly high, around 80% wastewater being directly released to the environment without going or undergoing any treatment. So that's a significant issue leading to the greenhouse gas emissions. And as in our previous panel, the young people were talking about the gravity of the problem that has been depicted here very clearly, that around 62% of water sector are contributing to the global greenhouse gas emissions, and that's also true for a region like Southeast Asia and South Asia in particular. If we come to Bangladesh in particular, what we feel and what I found from the different partners' database, that around 50% households in Bangladesh have toilets connected to the septic tank, and around 21% households have toilets that do not have any containment facility. So that's a very significant figure. If you see into the Dhaka city, the sewerage network, what we have found that around 20% households are connected from the theoretical point of view, but however, how much is really functioning, that's another issue. And all these connectivity issues and overall, the sanitation context here in Bangladesh and in Dhaka city in particular, it's also very important to underscore that around 70% systems are not really functional. And if I go to the next slide where you see that we are still in the unimproved or open defecation or the limited services in one from one another. So that's the bigger problem what you are having, and that leads to a negative feedback loop. When I'm talking about the negative feedback loop, it's related to the risk of health. It is the environmental degradations. Of course, from the climate mitigations point of view, the GSZ emission is another issue. However, in addition to the climate mitigations, climate resilience and the vulnerability and risk, which is making people more vulnerable and thereby giving them less resilience capacity to fight against climate change in a climate constrained world where we do feel that people are not having sufficient systems, sufficient technology, sufficient resources and financing to be resilient the way it should have been there. So that brings to the first presentation yesterday, what Professor Juliet was talking about, that the climate resilience sanitations, from response to anticipation, from proactive planning to the reactive actions. So those are very critical components to really keep in mind to break down this negative feedback loop from the health risk, from environmental risk, and both climate mitigation and adaptation, as the pathways for the low carbon development plan for a country like Bangladesh and other countries in this region. What we are having here in this slide, as you can see, I am putting some figure here from the WaterAid. Around 40% people in Bangladesh do not have decent toilet. You could also see in below around 25.3 million people in Bangladesh have inadequate toilets. These are the latest figure being published by WaterAid. And in terms of the greenhouse gas, which is CH4, methane in particular, is around 30.89 metric ton. I'm going to touch upon on that first, assuming that my colleague, who is the co-panel member, will talk about the climate resilience and vulnerability a bit. But let me first deep dive into the CH4 emission in Bangladesh or in Dhaka city or in the South Asian region in particular. What we have done as an UNICEF, we are going through a regional assessment. And in that assessment, what we have found that though in the national communication report of each of the country, which is an obligatory document to be reported to the UN Framework Convention on Climate Change, UNFCCC, Bangladesh has been reporting primarily wastewater as well as coming from the landfill or from the agricultural cultivations, but no direct reporting is really happening from the urban sanitation point of view. Based on the existing reports, and I'm also drawing your attention the latest paper being published by Rahman et al. Here in Bangladesh. And all those publications, as well as our own assessment based on the modeling what we have been doing, what we are finding that, what are we finding that around 3 to 4 times lower emissions are happening in terms of reporting from the CH4 in a country like Bangladesh, and that's a very significant amount. As you can see in my previous slide, it was only 30 metric tons, so if that can be 3 to 4 times, that will be around 120 metric tons in a year, and that's good enough for global warming, and that's having direct linkage with the temperature range, air pollution, transboundary problem with the neighboring countries from the climate and the water point of view. I think that's the point which I'm trying to highlight here. If I may go to the next slide, therefore, what we feel that from mitigation point of view, in Glasgow, in COP27, few countries have signed and endorsed a global methane pledge, and that could be one of the instruments for Bangladesh to consider. And based on the global methane pledge, we may consider how we are going for CH4 credit in particular. And that's a significant opportunity, not only from the greenhouse gas emission reduction, but very clearly linking that to the evolving Paris Agreement market mechanism, which is the Article 6. And the Article 6 of Paris Agreement has given provisions to the countries for market mechanism and the non-market mechanism. The 6.2, 6.4 of the Paris Agreement talks mostly about the market mechanism, which is directly linked to the domestic market. Here, I do understand many of you might have some of your own opinion about the carbon market, and I had the privilege to listen yesterday some of the reservation around that. But having said that, carbon market during Kyoto Protocol and carbon market as a Paris agreements are two different instruments. And I do feel that if you see the figure there, around $760 billion alone is a market size which is now transforming to $1 trillion economy as a market in 2025. And this is very crucial, primarily when we are having geopolitical issue in this world at this point of time. There are slash of reduction of the global aid from different countries. And so therefore, I do feel that this might be a catalytic financing to really consider how we're going to utilize this. In addition to that, the voluntary carbon market, domestic carbon market are going to be crucial, and that's going to be a game changer in terms of overall CH4 from the sanitation and water in particular. I am particularly talking here on the Article 6.8 because for those critics who may feel that market mechanism may not work, but in spite of not working, let us assume that is not working. The 6.8 article provides transfer of technology and non-market mechanism. The non-market mechanism talks mostly about how we are going to have better technology transfer as a commitment from an Annex 1 country to a non-Annex 1 country. For instance, if we are, if you see here the value chain or a supply chain, what I'm putting it here, we are having bigger source of CH4 from latrine with the pit or without, or with a tank. If you see the larger size in the landfill, there is also a significant CH4 emission is happening. To a certain extent, the fecal sludge management, there is an emission, but that's probably we can consider as a leakage in the supply chain. If we took into the piped sewer network and the wastewater treatment, that's also a medium scale CH4 potentiality. But for a country like Bangladesh, when we're talking about the technology and the innovative technology in the first plenary, yesterday, who is going to fund those technology? So probably we have to talk about therefore Article 6.8, where we are going to have an obligatory provisions under the Paris Agreement through the CTCN or similar sort of mechanism to transfer technology with certain cost and a responsibility coming from the developed country, and thereby they are having an obligation for investment here. And in addition to the parties or the countries' obligations from the Paris Agreement point of view, I do understand public sector and the private sector is also equally important. Yesterday, in the sanitation finance, we are talking about how we are going to use pay for services as one of the instruments along with tariff and the fiscal planning and other things as a part of the sanitation financing. And you might be very happy to know that UNICEF as an accredited agency of Green Climate Fund, we are also looking into the large-scale sanitation projects to be funded of a ticket size of $50 million to $250 million. UNICEF as an agency is having access to the grant funding. And so that's one of the vision what we are having in mind. We do understand that while we talk about the overall sanitation, climate resilience, sanitation in particular, that has to be looked into from the bigger picture of climate change. Here I'm putting about many things, which is a very busy slide here, but however, I just want to point out that we have to talk about averting, minimizing, addressing, and loss and damage. Loss and damage I'm talking about because many of our wash and toilet infrastructure, what we are designing today, is it resilient for tomorrow? So to a greater extent, we have to consider how resilient our infrastructure are. And for a scenario like 2020, 2030, 2040, 2050, based on the projections of the climate change, what is happening. If we see, there is very clearly a mitigation gap. As you can see in my previous slides, CH4 have not been talked at all in the policy level planning for different countries, not only in Bangladesh. That is true for Sri Lanka, that's true for Pakistan and the neighboring country like India and so on and so forth. We do feel that there has to be a protection gap, and that protection gap needs to be bridged with the inclusive planning and considering that how we are really developing the resilience capacity of the most vulnerable community of our society. And when I'm saying vulnerable community, I want to really, encourage all of you to think beyond gender, people coming from the lower income group. We have to put children at first. Children are at the core of the problem with the least and no resilience capacity. And to sum up what Juliet was talking yesterday from the global definition of climate resilient sanitations, we have to anticipate, we have to respond, we have to cope with this problem, we have to recover and build back better, as well as we have to adapt with a better resilience capacity. Having said that, unless we introduce the climate resilient sanitation as an essential component in the national climate policies and program, and in this case, it's the National Determined Contribution 3.0, which Bangladesh is planning to submit around mid of this year or later. That has to be integral part of the national policies and program if we want to really keen to mobilize innovative and climate financing, or we are very keen to transfer technology. Urgent action will be needed to integrate the sanitations and probably a better coordination from this group, from public sector, young people, public sector, the practitioners like you, a wealth of experience, how we are going to bring them together as a coordinated approach, and thereby facing this bigger problem as a big solution with far more bolder approach in the near future. So I'll take a pause here. We'll be very happy. I'm just in time. So thank you very much for listening.
Thank you very much, Keshav. I really took the notes, the important message of prioritizing and not compromising the health outcomes, but also environmental outcomes of poor sanitation, if not the other way, to how to improve those of communities through a climate resilient sanitation. And also importance of inclusive planning and then process involving everybody has a stake in the process. So that's a great segue to introduce Dr. Tanvir. Dr. Tanvir is a professor at the ITN BUET. Sorry, used to be. He has recently transitioned from ITN BUET to a professor at the Bangladesh University of Engineering and Technology, from director of ITN BUET. And he had served currently serving for the last 4.5 years, building the capacity of WASH professionals in the country and also in this region. And then he is engaged in shaping national policies, strategies, and guidelines, and then laid the citywide inclusive sanitation capacities building programs across the region with support of Gates Foundation. So over to you, Dr. Tanvir, on the gender inclusion side. Concrete examples, what are we doing, how we can do better.
Thank you. Thank you for the introduction. So as you can see, I'll be talking about gender equity, disability, and social inclusion in sanitation. Now, I've divided the presentation into 3 segments. How do we actually interpret GEDSI in sanitation? What are the challenges in sanitation services, GEDSI challenges? And finally, I'm going to finish with how we can actually mainstream GEDSI in basically sanitation projects. Now, to start the discussion, I think I'll leave it to you. Most of you probably have seen this famous Bollywood movie, Toilet, A Love Story. Toiletic Prem Katha. It tells the story of a young woman married in a rural Indian household, married to a family which does not own a toilet. Social tensions arise when she wants to install a toilet in the household, but the family won't let her. She was willing to part with the family by taking a divorce from his husband unless he installs a toilet. So basically what the message from this movie is that, especially for females, if they want to work and live in dignity, a toilet is an essential component. So toilet is equivalent to dignity. Quite unfortunately, we see sexual and gender-based violence when women try to access sanitation facilities. And this has come out from a recent report from Water Integrity Global Outlook, and says that even sextortion, which is a form of bribery when women try to access sanitation facilities, that happens. And this is very, very unfortunate. And we have seen some instances like this reported in Bangladesh as well. So there are safety concerns and dignity concerns with women accessing sanitation facilities. So the way we look at sanitation, we know that open defecation, from open defecation, there are different routes with which microorganisms or pathogens can reach human and affect our health. And having a well-designed sanitation facility with good containment is the first line of defense for disease prevention. But sanitation is much more than disease prevention. It has links with quality of life, human dignity, well-being, and environment. And we have to look at sanitation from the perspective of men, boys, girls, disabled, and other social characteristics, including age, ethnicity, religion. This is how sanitation has to be looked at from now on. Some alluding of this has been made in the SDG Target 6.2, where they say that by 2030, you have to access adequate and equitable sanitation by 2030, but note the last part, paying special attention to the needs and women of girls and those in vulnerable situations. And if you translate that to what do you mean by actually adequate sanitation, it actually translates into it has to be private, appropriately located, and meets women's needs and is safe. And equitable sanitation means it's not only the women and girls, but also those who are in vulnerable situations, like elderly people, their needs has to be met as well. But whenever we see sanitation facilities around the world, we see problems. Sanitation facilities, some sanitation facilities, toilets cannot be accessed by people with disabilities. For example, like this, many wash structure. There are other challenges as well. People who are very poor, they cannot purchase, they have financial constraints for constructing infrastructure. There are language and cultural barriers, and even there are inadequate public toilets for migrants and day laborers who are scattered all over the city, and they have inconsistent access to sanitation facilities. So this is a problem. The whole problem is exacerbated if you have something like extreme weather disasters. Like, for example, in this case, when the whole sanitation facility is flooded, it becomes a problem for access to us, of course, but what about the disabled and elderly? It's a compounded problem for them. So these are some instances where we have to take care of. But it's not only the access and the lack of sanitation facilities. There are many compounded effects that can affect women's well-being. We have studied in this instances 2 cities in Soedpur and Meherpur with a research with Emory University. We have found that privacy, safety, and bodily integrity probability, these are associated with lower anxiety. And women are also suffering from anxiety and depression because they don't feel that their sanitation facility is safe, private enough. It doesn't have lockable doors. It's not well lit, and they're having problems accessing sanitation facilities. And we have seen good outcomes. If you have a decision-making role in the municipality or in constructing sanitation facilities, you do have, and these are, your well-being factors are enhanced. So all these examples are here, and we have research-based evidence that this is actually happening. Going away from the toilet, if we try to look at the entire sanitation value chain, there are also other vulnerable people around who are providing essential service to us as sanitation workers, but their occupational health and safety, dignity, and well-being are quite overlooked by the system. They have social and economical insecurity. Even sometimes formalization of their roles has unintended consequences, like they're sometimes put out of job, earning less money. And I'm not getting into detail of that, but this happens. There are many problems associated with it. So these are also a part of the vulnerable group. Now, having all these examples and instances, what can we do? Maybe it is a time to look at sanitation from a different point of view. For sanitation, we look at things from an infrastructure point of view, but sanitation is more than infrastructure. It is a combination of well-managed services, and that services has to be, and the one way of addressing those services is basically the citywide inclusive sanitation approach. The citywide inclusive sanitation is a holistic approach of looking at sanitation, where you don't only look at infrastructure, but you have to look at well-functioning services. And those services has outcomes, when one of the major outcomes is equity. And all that I have mentioned are now embedded in this equity outcome. So, women, girls, and marginalized groups, they have to be included in decision making. Users and workers, they need to be incorporated into hiring, service delivery, and planning. And occupational health and safety of sanitation and waste workers, that has to be ensured. That's how you ensure equity and partly safety. Now, the next few slides, I'm going to give you some examples and maybe some strategies on how we can actually mainstream this through citywide inclusive sanitation projects. So everything has to start from planning. We have examples, as we know that there are some certain female disabled-friendly designs, conveniently located, also sex-segregated, has MHM facilities, and we have some very good examples, and you've seen that probably in previous presentations, that this is also possible, and we have to mainstream this through planning. There are also slum areas around the city, and we have to provide access to those vulnerable people as well. So we have to identify those neighborhoods and look for ways to connect the poor to the existing sanitation facility. This is an example where we are looking at, you know that Dhaka Wasa is making large investments to construct trunk sewers for Dhaka Sanitation Improvement Plan supported by the World Bank. And this was a study where we looked at this trunk sewer main is going to pass through the rural slum, the slum communities, etc. But will they be able to access the features of the high-end sanitation facilities? So we looked at strategies, and we found that there are possible ways on which we can connect the slums with the STPs and things. So this is a publication on that. One way of mainstreaming is, of course, involving women in enterprise development. There are different ways. They can start business with toilet sanitation facility provision, waste management, innovative technology development, and even selling and distributing menstrual hygiene management projects. And these can also be built into the programmatic, into projects. Institutions. Women can also have positions in sanitation committees, and we have already set quota for women in sanitation project planning and decision making. There are dedicated pro-poor units, and this is an example of Faridpur, where female councillors and panel mayors in Faridpur municipality, they are playing a very critical role. And maybe tomorrow, if you go to Faridpur municipality for the study tour, maybe you can see and talk to some of these peoples. Women are also engaged, in this case, marginalized community in the Ekota Horijon Mohila Samobai Samiti, supported by the Practical Action Bangladesh. They are involved in managing sanitation infrastructure. It basically shows that if you form cooperatives and if you are engaged, if you have a positive view from the local government institution, you can take care of many of the operation and maintenance facilities. You can have partnership with the local government institutions, and different financial mechanisms can also be, so in your field visit, you can also maybe talk to them and how they are actually managing it. They now have positions in the municipal executive body, and they are contributing to the operation and maintenance of waste management sanitation of the public toilets. Capacity building and training is important. we have specialized capacity building modules targeting gender, how to mainstream gender, what are the challenges, how you can overcome them, and through this you also have to develop. Now, whether or not gender mainstreaming is happening, you need to monitor, assess, and evaluate. Otherwise, you don't know what real progress is being made. There are different indicators have been developed through research, extensive research and validated through different. One of them is the sanitation-related quality of life index, which basically looks at the men-women disparities regarding privacy, etc. There was gender equality measures. And latest one is the agency resource institutional structures or sanitation-related empowerment, ARISE, developed by Emory University. They look at the women's empowerment in the local government institutions and how it's affecting their sanitation decision-making, etc. You're probably aware that the WHO UNICEF Joint Monitoring Program has now 3 gender-specific indicators. And they have added this, and it's now going to be piloted now in different countries. And you know that in the SDG target 6.2, it mentions about women and vulnerable groups, but there are no indicators for it yet. The only indicator is 100% safely managed sanitation and that part. Now they have added 3 gender-specific indicators which look at whether our women are being harassed or they're feeling safe or feeling the necessary privacy in accessing sanitation facilities, more at the community scale or even individually. Those indicators are there. If you want to monitor progress in project level, there are also COIS indicators. There are gender markers where you look at projects which have gender intentional, gender transformative, or gender unintentional. These categories can be made. Sex, age, disability, disaggregated data systems, those have been developed, and you can use that to monitor progress of GEDSI at the city level. Let's look at some examples of GEDSI implementation in sanitation in investments. In Bangladesh, we have the 10 Towns LLF project. It has specific actions or cost items which targets LICs, vulnerable groups, capacity building, institution, and livelihood, all developed in the frame of under the framework of citywide inclusive sanitation. And these are the areas where it is targeting equity particularly. Another project is in development, which we call the WISE project, Women in Sanitation Entrepreneurship. Here, for both the projects, Islamic Development Bank, working with the Department of Public Health Engineering, Government of Bangladesh. And this project, this is actually a technical assistance project, which basically looks at how to boost women's enterprise, access finance, and increase women's participation, especially look at how to facilitate women-led small and medium enterprises. So we have very high hopes for these projects, and the success of these projects will probably chart the course of action of gender mainstreaming future in Bangladesh. Now, coming back to the end, I have just basically 2 key points. One is that, and if you have an exclusionary mindset in sanitation, it prevents the society as a whole from reaping the true benefits of sanitation. So even if you invest in sanitation, but if you have an exclusionary mindset, the true benefit of sanitation will not reach the vulnerable, the poor, and the marginalized. And that the true benefits of sanitation will not be realized. But the good thing is that we have a reasonable knowledge now on what the challenges are, how to overcome them, and how to track, monitor progress of GEDSI in projects and programs. And maybe we should now focus our attention on that. And I believe, this is the last slide, I believe the theme of the last World Toilet Day 2024 has a very big GEDSI component in it. The main message is that toilets are a place for peace, toilets are a place for protection, and toilets are a place for progress. And peace here is not only the absence of war, as mentioned by the note by the Secretary General of United Nations. Peace, it has a broader meaning. It rejects violence and social injustice, poverty, discrimination against women. So I think by having your toilets safe, secure, private, lockable, women-friendly, addressing all the vulnerable communities, vulnerable people in the sanitation service chain, we can make the sanitation system as a symbol of progress, symbol of dignity. It's a place for protection, and eventually it will lead to peace. Thank you very much.
Thank you very much, Dr. Tanvir. With the time, and I know we started slightly late, but we would like to have a little bit of a discussion and also open the floor for a few questions, if possible. So first of all, I have a power to ask you guys one question each, perhaps, following your presentations. And I will start with Keshav. In your presentation, you mentioned about the not enough, if not no data in a nationally determined contribution, the national document on climate change around the impacts, if not the actual data on on-site sanitation services, some on wastewater and the landfill, but not so much. And there's a really urgent need to have those data and more possibly research and evidence generation around both climate mitigation, but also adaptation, and how climate resilient sanitation can be part of that whole climate agenda. So around this data issue, could you elaborate a little bit more around what are existing, if not upcoming initiatives, and what we can do more around, especially in the linkages with this inclusiveness, importance to integrate and understand better of the impact to children, marginalized groups, those who are impacted the most.
Thank you, Maya. Just as a very quick response to that, firstly, the existing data on sanitation from the mitigation point of view, most of the countries are using tier 1 methodologies, which is of good practice guidelines of IPCC. And there is a very huge margin of error. Whereas now we are having tier 2 methodologies with satellite imageries and others, giving accurate informations. Yesterday, there was very good technical sessions on data, and that has very rightly identified how we can collect data at national level, at federal, at the sub-national level, and the municipalities level. I think that's brilliant ongoing work, if I may put it in that way. But however, if we talk about climate resilient wash or climate resilient sanitation, we have to have climate justification and the rationale coming from the climate point of view. And that is grossly missing at this point of time. Thanks to Green Climate Fund or other donors, multilateral and the bilateral donors, they are talking about climate resilient sanitation, but however, what sort of vulnerability risk we are talking about? That's grossly missing again. So what we are doing as an UNICEF, we are taking now a regional work to do and set up a scenario for 2030, 2040, 2050. But our point of entry is not only the larger scale of the vulnerable group, we are also centering at children. And therefore we are looking at how the children and the other group of people are vulnerable because of the changing climate, with an outlook, with a foresight of those time series data, 2030 to 2040 and 50, assuming that most of the countries are submitting their long-term carbon development plan to the UNFCCC with a vision of 2045 or 2050 in particular. Now, this will be a critical piece of information and data, which will talk not only the greenhouse gas emission accounting, it will also talk about the climate resilience capacity of people. What is probably if you allow me, I'll bring the loss and damage to that too. In Baku last year, we also talk about new climate quantified goals. When we talk about NCQZ, new climate quantified goal, it's now going to be mandatory to quantify how much financing will be needing, climate financing will be needing for water sanitation sector, for an example. Now we really cannot give a Christmas shopping list that this is the type of funding we have to have for climate resilient wash. We have to quantify that. Now to quantify that, we have to have data. To have the data, we have to have VRA, the Vulnerability Risk Assessment. And that brings to the loss and damage also. What we have been working as an UNICEF with, in this region with Sri Lanka for instance, as well as that goes to even to Nepal, what we are supporting to design the framework of the loss and damage, that how much damage will be caused, and what will be the economic loss to be occurred in the social facilities, could be health, could be was, and so on and so forth. So cost of action need to be reflected well in the new climate quantified goal, and which is going to be considered as the legitimate document for climate financing and allocating to the countries. And secondly, we also want to amplify the gravity of the problem from the climate resilience point of view. If that action is not happening, what will be the cost of inaction? And thereby how the community are going to suffer out of that. So I'll take a pause here, and over to you, Maya.
Thank you very much. With my limited knowledge around the whole climate negotiation and the sector, I still do understand that Bangladesh being really prominent and then instrumental in bringing this loss and damage issues and then creating that fund globally on this issue, and then important to have that cost of damaged infrastructure, if not cost of no action, so that sanitation, having the poor or no sanitation services need to be part of that conversation. So now I'd like to move from the impacts of climate change to the infrastructure and also services, so more the vulnerability side, to more how can we do more, and also how can we make that more inclusive. I'm really trying to make here the nexus between the two important issues. So I'd like to come back to Dr. Tanvir. You mentioned already some examples earlier around how women and also the vulnerability groups being part of that solution. Improving sanitation services, expanding that services to wider those unreached communities. Could you tell us more in terms of the examples linking with this now increasing impacts and the risk of climate change, and an example of involving, empowering these groups to be part of the solution?
Thank you very much. I think we have some pilot studies here where women's involvement in wash services maintenance, especially in the climate-affected areas. WaterAid has numerous examples, and I think they can elaborate more on that. But it's also more important for women to have be a member of the decision-making system. And we have shown through, there's research saying that if you have women in deciding in the decision-making system, you have a seat at the table and participating in those discussions, what sort of sanitation facilities, what sort of they prefer, and ultimately the projects are developed based on that, then you have better outcomes not only in the service level, but also on their own well-being, and these have been tested through various methods and models. But we also have to make sure that even if you involve women in decision making, sometimes it happens that in pen and paper you have their participation, but the real participation probably is not welcomed, or that I mean there are barriers to that, and we have to work more there. The policies and the rules, these are important, so you cannot have exclusionary policies. In Bangladesh, we do not exactly have exclusionary policies. I think at the municipal level, you have a certain quota for panel mayors and other positions. But whether or not these positions are properly utilized, that needs to be monitored. And how they are actually participating in the decision making, whether or not they're feeling free to participate in the decision making, these things are important. And I think this will play a big role. And overall WASH monitoring, I think, and WASH operation and maintenance, women's participation, definitely we have seen numerous times that you have better outcomes. And I guess that's all. Thank you.
Thank you very much. Yes, important to have the quota and the guidance, but also it needs to be enforced really in practice. So with a limited time, but if there are any questions from the floor, okay. Yes, already I'm seeing one hand from a lady there. To the panelists, please.
Hi, so I am apologizing in advance if this question is going to offend anyone. But sir, when we are talking about gender equality and when we are talking about social inclusion, are we forgetting the Hijra communities in our country? Nothing, like I have seen people not having access to sanitation and like people not giving them access to sanitation. So gender is not about only men and women. They are also part of us. And when we are working with the notion of leaving no one behind, are we leaving them behind? Because climate is not only affecting men and women, climate is also affecting them. They do not also have access to sanitation services. But whenever we are talking about it, we are just talking about men and women. What about the third gender that our government has termed them? What about them? So that is my question.
Okay. With the limited time, if there are other questions, we will take a few questions first. 1 and 2. Yes, maybe that we could do with, unfortunately, the time.
Thank you. It was excellent listening to the presentations and the panel. Professor Tanvir, you did an insightful and quite an interesting presentation there. One of the things that you suggested was also about the mindset, which can be easier said than done. I was just wondering if you could walk us through quite a few practical or pragmatic suggestions as to what could be number 1, number 2, number 3 things in terms of, talking about and opening up the positive mindsets of the policymakers or the other partners who are going to be together in this journey. Thank you.
Okay, this is Shanjon. I am working in Oxfam, Helvetas. So, you know that we are saying in SDG 6.2 for all, and our theme was 2 here, gender equality, and also, that disability and social inclusion. So when we are saying about inclusivity, then regarding inclusive design of the sanitation facilities, then you know that we have to think about also the time, seasonal variation. So if we say about girls, women, disabled people, sick and elderly people, so regarding the time variation, the seasonal variation, the people have to access such a sanitation facilities, then they can use any time. So my question is, in this regard, what is our thinking regarding design and everything actually? That's all from me.
I'm sorry, at the end, what's our thinking regarding? Sorry, I cannot hear very well.
Regarding use of sanitation facilities, considering the timing, suppose at night, if it is out of their, the distance, at distance from their household to, the sanitation facilities.
Okay. Thank you very much.
Like timing and also seasonal variation, like you know that there is rainy season and winter and dry season, etc. Thank you so much.
With the time, we would like to first answer the questions first. So the first question around the impact and also role of shared identity, not women and men. Would you like to take Keshav?
Yeah, I think I'll be clubbing all the 3 questions together. And on the first question from here, I would like to bring 3 components together from the climate point of view. One is Lima Enhanced Framework. or which has been agreed and extended for the next 10 years in Baku. Baku COP29 has given three beautiful things. One is the Lima Annans framework, where we talk about gender and the gender not in isolation, gender in agriculture, gender in water, gender in so and so forth. I think that's a brilliant development. So specific priorities are there. And from the country's engagement point of view, by March 2025, all countries are encouraged to submit their priority areas from gender, linking to agriculture, energy, water, and so on and so forth. So I think, therefore, that brings me to policy part. But before I go to policy, in the Global Goal Adaptation, GZA has identified 21D and 21F of the clauses of the negotiation text, the final negotiation text, has identified two things very clearly, that people from the gender point of view, women, socially excluded people, the indigenous community, people with disability, the diversity from the sexual orientation point of view, that has been categorically mentioned in 21D and 21F of the Global Goal Adaptation's negotiation text. So in the climate picture, bigger picture, that has been covered. How that mandate has been percolated down to the country level, that needs to be ratified at the parliament level here. Now that brings to the second point, the 7A, the clause of the new climate quantified goal has also quantified children, people with disability, and blah, blah. So that is very well covered. So I am a big fan of climate policy and processes, so therefore I am talking in that way at this point of time. Now coming to the question from here, how the national policies can be part of that. I think GZA, the Global Goal on Adaptations, and the NDC in particular, if we want to influence policy making, we have to have evidence. And that is the reasons we are talking about the evidence generations through the vulnerability and risk assessment at this point of time. I have my Chief of WASH here, Peter, who was also, yesterday in the first plenary. We are talking from the technology point of view. Professor is also sitting here, and the other colleagues. We are underscoring one thing: technology will work, technology transfer will happen. For that, we'll be needing financing. To get the financing, we have to have in policies specific targets to be mentioned. What new climate quantified goal we are talking about? I'm talking primarily from the climate finance point of view. So I think these are very critical component. And the last question, I think the services which are available to everyone and it is affordable, that again come to the policy and the overall system creations here. So I'm handing over to Maya.
Thank you very much, Keshav. You answered already the three questions, then I am getting a little bit of sharp eyes on me that we are running late. So actually, I'd like to pass to Dr. Tanvir for wrapping up, and then some insights at the closing of this session.
Thank you. I'm going to wrap it up very quickly. I think Keshav perfectly answered all these questions, and what I want to say that we cannot have exclusionary principles in our policy level. Of course, gender doesn't mean only male, female. It also includes transgender and indigenous and all other things, all other religious minorities or other minorities, marginalized people, everything. We have to look at if we have anything unaddressed at our policy level. If not, then whether or not we are able to address those policies really being percolated downwards, as Keshav mentioned. And if we are not doing a good job over there, maybe then we have to look at those areas and work on those. If we have successful examples, maybe we can replicate some of these at the programmatic level and the project level. And as you see that a lot of exercises that we have done in the past 5-10 years are now being implemented through the government through large-scale development projects. So if we have the confidence to push those through in here, that will see the real success of all of these programs. And I think that's kind of the way forward. We have to really make very good examples and create the confidence that we can really have these. And it applies to everything. Thank you.
Thank you very much, both, and thank you for your valuable contribution and the sharing of your knowledge. I'd like to then close this session, but I hope you can go deep dive on the issues and started to be unpacked slightly in technical session this morning. I think there are several on these relevant issues. And also in the open area right after this room, there are some of the voices of sanitation workers being displayed. So if you have not been there to hear or read their own voices and experiences, please take some time to look at the display over there. Thank you very much. And thank you.
Thank you, our honorable guests. We extend our heartfelt gratitude to the moderator and keynote speakers for sharing their expertise and wisdom. Ladies and gentlemen, this is just the beginning of the day. And now we are taking a break for tea, after which we will continue our plenary session on innovative technology and private sector engagement at 4 p.m. And now we are taking a break for tea. And ladies and gentlemen, a gentle reminder, snacks will be served now at the lounge in front of the Crystal Ballroom. And who have sessions at the first floor, you can enjoy your snacks at the lounge in front of the Madhumati and Turag Ballroom. আমি আবারও একটু বলে দেই, আমরা ছোট্ট একটা বিরতি নিচ্ছি, ছোট্টই বলছি, কিছুক্ষণের মধ্যে আবারও ফিরে আসছি আমরা 4টায়। আমরা 4টায় ফিরে আসছি এই বলরুমেই আবারও আমাদের প্লেনারি সেশন নিয়ে, যেটা আমরা বলছিলাম যে ইনোভেটিভ টেকনোলজি অ্যান্ড প্রাইভেট সেক্টর এঙ্গেজমেন্ট নিয়ে। আর স্ন্যাক্সের ব্যাপারে একটু বলতে চাই, যাদের ওপরের ফ্লোরে সেশন আছে, ফার্স্ট ফ্লোরে সেশন আছে, তারা ওপরের ফ্লোরে আপনাদের মিল এনজয় করতে পারবেন, কোয়ালিটি টাইম স্পেন্ড করতে পারবেন। আর যারা এখানে বলরুমে আছেন, যাদের এখানে সেশন ছিল, তারা আমাদের সামনে ইন ফ্রন্টে ক্রিস্টাল বলরুমেই আপনারা এনজয় করতে পারবেন। প্লিজ এনজয় ইউর স্ন্যাক্স। থ্যাংক ইউ।